Recombinant tissue plasminogen activator means this also a tissue plasminogen activator used to dissolve the clot, but it is produced by recombinant technology. That's why it is called as a recombinant tissue plasminogen activator. Let me discuss in detail. Contains definition, mechanism of action, adverse effects, contraindications, and uses. Let me discuss about the recombinant tissue plasminogen activator. So you already in the previous video we discussed about the thrombolytics or fibrinolytics. So this recombinant tissue plasminogen activator is also a thrombolytic or fibrinolytic which is used to reduce the clot. So usually the first generation thrombolytics like streptokinase or urokinase, how it will works means it will activate the um, plasminogen, means that is naturally occurring in the body. So that plasminogen will be converted to plasmin by tissue plasminogen activator, means that is a protein acts as a enzyme and it will converts the plasminogen into plasmin. This is naturally occurring in the body. So if you're using first generation means first they will activate the plasminogen, then the enzyme involved in conversion of plasminogen into plasmin. So if we need a rapid breakdown of the clots, that's time we can go with the recombinant tissue plasminogen activator to get a more rapid action. So this tissue plasminogen activator is a protein involved in a breakdown of clots. So this tissue plasminogen activator can be manufactured using recombinant technology. That's why it is called as a recombinant tissue plasminogen activator. Let me see the mechanism of action. So this recombinant tissue plasminogen activator converts the plasminogen into plasmin. So this plasminogen is naturally occurring protein and usually it binds to fibrin, the clot. So this recombinant tissue plasminogen activator will convert the plasminogen into plasmin and this plasmin will degrade the fibrin. So finally there is a dissolve of the clot. This is the mechanism of action of recombinant tissue plasminogen activator. Here the steps also is very less. So directly it converts the plasminogen into plasmin and that plasmin will degrade the fibrin clot. So within 2 steps we'll achieve the dissolve of the clot. So for rapid action for dissolving the clot we'll use to go with the recombinant tissue plasminogen activator. Adverse effects, so usually it causes nausea, means we'll feel like vomiting but we won't vomit, and also it causes vomiting and dizziness, mild fever because of immune action, means our immunity will react with that because of rapid degradation of the clot, and also it causes low blood pressure. Why it will cause low blood pressure means it causes the vasodilation and allergic reactions because this recombinant tissue plasminogen activator is a foreign substance. Our body will consider that as a foreign substance, and when our body immune system will react with that, so usually it causes inflammation and release of the histamine, so that it causes the allergic reactions. Contraindications, so when we should avoid means we should avoid in case of hemorrhagic stroke, means the stroke is formed due to the bleeding in the brain, so that condition we should avoid the thrombolytics like tissue plasminogen activator, otherwise it will cause the further bleeding. And also in case of head trauma, because when head trauma means head injuries happen, to avoid the loss of bleeding will give the coagulants. If you given thrombolytics, again it degrades the clot and bleeding will start, so that we should avoid in case of hemorrhagic stroke and in case of head trauma. Use, it is used in a heart attack, then thrombotic diseases, and also in case of stroke. So in these conditions we'll use the tissue plasminogen activator. Thank you.